Healthcare is by far one of the top priorities among American voters heading into this general election. As Joe Biden and President Trump get set for their final debate tomorrow, it is going to be one of the top issues that will be focused on. The president's initiative, called the America First Health Plan, has been both hailed and criticized by national health experts. Dr. Lee Carisco used to practice medicine in Canada and is now a physician here in Minnesota. You were at the president's rollout of the health care plan last month, Dr. Carisco, and you recently wrote an opinion piece, which is why I reached out to talk to you, because you touted the president's plan. So you started that article, though, saying that you're disappointed with the media coverage of this. How so?
Well, I was physically in attendance for the rollout of his plan, and I really thought it was quite a strong plan. But then over the next few days, when I went online to find out what the media was saying about it, they weren't really saying much. And even at the presidential debate, Joe Biden mistakenly said that President Trump does not actually have a plan, but he actually has really quite a good plan. And the reason I'm sensitive to this whole issue is because I worked in Canadian healthcare for 13 years before I moved to the United States in 2002. And fairly early in my career, I became medical director of diagnostic imaging for Thunder Bay, Canada, at the regional medical center there. And we faced horrendous problems. Our waiting time for an MRI was 13 months long. For a CT scan, it was 7 months long. We had old, dilapidated equipment we had to work with. It was not uncommon for physicians to see a specialty physician wait up to 2 years. The whole problem was that healthcare in Canada is centrally financed and controlled by the government.
As you compare the U.S. Healthcare system to the Canadian system, is that because that's basically what we would be looking at under a Joe Biden plan, and how other Democratic candidates who were running for president are really looking to shift our American healthcare system?
Yes, exactly. I mean, the basis of the Biden plan is to reinforce the Affordable Care Act with more subsidies, expansion of Medicaid, and a public option. The problem with the public option is, the private dollar has to compete against the public dollar, and so slowly the private system will be squeezed out. The other major problem with the Biden plan is it really does absolutely nothing to address the root causes of the problems in healthcare right now, which is a lack of a transparent, competitive system in which providers of healthcare, doctors and hospitals and so on, actually compete for the people's dollars. And what we need to do in healthcare to basically fix the problem is we need to move away from a government-based, third-party-based healthcare system to a personalized healthcare system in which people control the dollars themselves, whether it be through their private insurers with robust savings accounts, or even within public programs such as Medicare and Medicaid, in which money is put into accounts that they own and that they use to shop for care. And that's their money. They own it and could conceivably even pass it on to their heirs. And in fact, Vice President Pence actually has used such a plan for Medicaid in Indiana, where he has integrated health savings accounts actually into the Medicaid plan there. That's what we need to be moving for. The problem is with a government system, which we would inevitably move towards, Medicare for all. That would be the Biden plan would be an incremental approach in that direction. It's going to become more ossified and more government controlled, where bureaucrats are making choices rather than individuals making choices.
Let me ask you this, Dr. Carisco. As I have done other interviews about health care, and whether it's a Democratic plan or a Republican plan, the bottom line is costs are outrageous. They really are. A simple blood draw for me. I went to the doctor just a few months ago, and because it's itemized now, I can see how much exactly it cost for a lab tech to stick a needle in my arm. And this is not including the lab work that got done. $300 just to stick a needle in my arm. Now, the bigger problem is healthcare costs. So I just want a candidate who says that they're going to lower healthcare costs across the board, because the rates are incredibly outrageous.
No, I completely agree with you. And the problem is healthcare costs cannot be lowered by fiat effectively. I mean, governments can simply say they're not going to pay for things, but it doesn't mean that the same level of service is going to be available. It just means that you may wait longer, the quality of care is going to be reduced.
Carisco, I do appreciate this. I'm at least able to follow along with you. A lot of times we have these discussions and I get lost in a lot of the wording and the verbiage. It gets very difficult. It's a complicated issue, that is for sure. I appreciate your time and your insight on it.